Becoming a pediatric dentist means surviving pediatric dental residency. So stay tuned as we talk to a PGY2 second-year pedo resident about all things pedo as a resident. Stay tuned. Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, surviving dental school, getting into residency, surviving residency, and then also life as a new dentist. Be sure that you subscribe to the YouTube channel, hit the bell notifications down below so that you're notified every time new releases come out. Also, this episode of Ask Dr. Darwin is brought to you by Dr. Darwin On Demand. Dr. Darwin On Demand, the exclusive new membership community for new dentists, as in new dental students, current dental students, residents, new dentists, and also international dentists looking to get licensed in the U.S. A lot of big, a lot of information, a lot of big things happening in this community. Weekly Q&As, monthly masterminds as well, and a community where you can share and learn from one another. For more details, check down below, thenewdentistcoach.com/on-demand. thenewdentistcoach.com/on-demand. And we'll see you in the community real soon. So today we are joined all the way from the West Coast, waking up early, so she can share her experiences as a pediatric dentist, as in training. We have with us Dr. Taylor Addison. How you doing, Doc?
I'm doing well. Good morning. Good morning.
Good morning. She got that low West Coast chill out voice this morning. So introduce yourself for those that are meeting you for the first time.
Yes. Well, first, thank you for having me. I appreciate being able to share. So my name is Dr. Taylor Addison. I'm originally from New Orleans, Louisiana. First I attended undergrad at Louisiana State University. Then I went to Meharry Medical College for dental school. And now I am a second-year resident at UCLA Pediatric Dentistry program.
Awesome. So let's brush it up. Let's get into it, because a lot of people really want to know about pedo, especially it's one of the top residency programs and one of the most competitive to get into as well. So so first, why pedo? Coming out of Meharry, you probably had a lot of different choices as far as your paths as a new graduate and all the different specialties. Why pedo for you?
So when I first started dental school at Meharry, I realized that I'm someone that likes to be good at one thing. So I had that specialist type of personality. So throughout the different specialties, when we learned about like pros and ortho, I feel like I kind of dabbled in a little bit of everything in dental school. But I still was trying to figure out, okay, what is something that I can do pretty much forever? So still, trying to figure out what's going to be for me, but it wasn't until I went on a mission trip to Jamaica that it really set in. So when we were on the mission trip, I realized that no one really wanted to see the kids. I was the only one that was like, okay, I'll do it. And then once I started to just do extractions on kids, do some cleanings, I just felt that, I don't know if, everyone's spiritual or not, but I just felt that connection, like, okay, wow, like I'm making a difference. This feels good. I'm having fun. And it just felt right. So I decided to just go with that feeling, and now I'm here. So that's pretty much my why pedo.
Awesome. So, you apply to pedo. How many schools did you apply to, and what were the interviews like?
Ooh, okay, so I applied to 12 schools and I went on 10 interviews.
Wow.
So, and this was before Corona, so I was traveling. I guess a little bit of the downside, I did miss a little bit of clinic time going to the different interviews to be there in person. But a lot of the interviews consisted of some time with the residents and then time, typical interview with program directors, attending faculty, things like that. So you pretty much the day was, it consisted of a tour, and then you spent a lot of time with the residents. And I feel like that's one of the most important parts of the interview, because they get to, just see the real you. Everyone is putting their best face in front, the attendings. And but when you're around the residents, that's when, they get to see your personality and
Yeah.
see if they can even just vibe with you and work with you for throughout the program.
Yeah, that's key, and that's
Mhm.
something that you always got to keep in mind. Being able to tap into the residents, because they also have a voice, right? Because you're going to be
Yes,
working with them, and they're going to be working with you. And those
definitely.
program directors want to know, what do you think? What do you think about Taylor? What do you think? How was she?
And that is
Um,
exactly what happens. Because being on the other side of it, residents do have a say. So I know for UCLA, what we do, we have interviews with you have resident interviews, and you have interviews with some of the faculty and the attendings. But I would say that for us, we like to make the interview fun, because we're looking for someone that we know you can work hard. If you get an interview, you are qualified. On paper, you have everything that you need. So
right,
at
right.
that point, it's just about if you're a good fit for the program, and if the program is a good fit for you, because you have to remember that, you are the prize too. The programs need residents to run the program. So just finding that perfect fit, I think that's something to keep in mind.
Yeah, that's good. That's good. So tell us, walk us down the street of a typical week for a pedo resident, especially ones at UCLA.
Okay. So UCLA is a hospital based, and it's a combined program, hospital based and didactic. So I'll walk you through Monday through Friday. So Monday, the day is split in half. In the beginning, you'll have a regular clinic day. You'll see a couple of patients. This can be anywhere between like new patient exams, recalls, special needs, things like that. And then in the afternoon, we have literature review. So we go through all of the most current literature that we're using as far as to support everything that we do, because all of our practices are evidence-based. So we review literature from all different topics. So that's Monday. Then Tuesday, it's more of like a sedation and ortho. So in the morning, either you're in the OR seeing patients, or you are seeing patients doing oral conscious sedation. And then in the afternoon, we have a ortho lecture, but it's more of, when I say lectures, more seminars. So we're presenting cases. It's more of a discussion than someone clicking through a PowerPoint and just talking at you. So I love that, the seminar series. And then we actually see patients in the afternoon for ortho. So we do anywhere between interceptive ortho, and some of our patients who have been with us for a long time, we do comprehensive ortho as well. So I've experienced with placing like full FEAs, placing brackets, different appliances and things like that. So we get a really
Now,
good.
explain to people what FEAs are, because some people may not know.
Yeah, so fixed edgewise appliance, so placing brackets on teeth. So we get a really expansive ortho experience because a couple years ago, the program actually was a dual pedo ortho program. We have really good ortho attendings and faculty that teach us a lot of ortho. Like, I think that that's one of the strong suits about UCLA, is the heavy ortho component. So I know some people, like for me, at one point in dental school, I was kind of teetering the line. I was like, do I want to do ortho? Because I know, that is where, a lot of people are interested in. I feel like for me, when I first started dental school, like the hype was around ortho. Everybody wanted to do ortho. So I'm really glad that I'm in this program that does give me that experience as well. So that's Tuesday. Wednesday is our IVGA, or IV general anesthesia, that we do in the clinic. So we get to treat kids, we have them completely asleep. And I think that's also one of the strong suits about our program as well, because we work with a dental anesthesiologist. But as a first year, what you get to do is pretty much be the anesthesiologist. So you are giving the kid the IM, intramuscular injection, you're putting them to sleep, you're pushing the drugs, all while supervised by anesthesiologists. You're monitoring them, you're attached to them with a pretracheal stethoscope, listening to their heart rate, to their breathing, recording everything. So you really get that anesthesia experience as a first year. And then the second years are actually doing the full mouth dental rehab. So that's really a strong suit about the program. And a lot of programs don't have that as an option to do, to not only go to the OR, but to do these general anesthesia cases in the clinic. So we do that for our healthy kids. And so that's Wednesday. Then Thursday is just a complete day of clinic in the morning and the afternoon. Sometimes during lunch, we may have some like seminar series where we present cases on patients with special healthcare needs, but it's pretty much a full clinic day. And then Friday, it is in the morning, it's clinic. And then in the afternoon, we have some courses, and it's mostly centered around public health, which I love about the program. Just getting to know and meet people's needs. And I feel like that bridging that gap in healthcare, a lot of professionals don't understand like social determinants of health and different barriers that the community is facing when it comes to their overall health. So I really appreciate having those classes in the afternoon as well. But throughout the entire 2 years, there are various rotations that you will be on outside of that typical Monday through Friday kind of clinic schedule. So some of the rotations include a teaching rotation. So we do a lot of teaching, which is a good experience because if you can't explain it, then you don't really know it like you think you do. So I do enjoy the teaching rotation. We have an anesthesia rotation that we go on. What else do we have? We have Peds Med. So working hand in hand with our pediatricians, we go to an autism clinic. And then we also have a infant oral healthcare clinic that we go to as well. So it's a lot of rotations within that schedule.
Wow.
So
Yeah, you
yeah,
guys stay busy.
yes, very busy.
Yeah, that's that accreditation, the code accreditation standards keeping y'all busy.
Yes, yes.
That's awesome. That's awesome. So that was Thursday, and what happens on Friday?
So that was right. Thursday is a full clinic day. So I didn't really
Okay.
get into much to that. But
Yeah,
Friday is the clinic in the morning and then the public health
public
courses in
health.
the afternoon. And that's something, if you are interested in public health, UCLA does offer a master's in public health while you're in the program.
Ooh, so that's another year.
No, so you do the master. So actually, one of the first years right now, we have one first year and then we have 3 second years. They decided to do the dual program where it's one Saturday. I'm sorry, no, not one Saturday. It's one weekend out the month that you take these classes. So
Every month. One
every month.
weekend every month.
Yeah, one weekend every month. So essentially, you have a long week, like you work Monday through Monday. But what they do is they take these courses, and by the time you finish the program, you obtain or you've earned your master's in public health.
Wow, that's great. That's
Mhm.
great. So one thing I didn't hear, which I know you guys do, is research. So tell us a little bit about the research that's required, and maybe share with us your research project.
Oh, yes. Okay, so you definitely have to do research. I'm pretty sure this is all residency programs, not just pedo, right?
Yes,
Um,
yes.
yeah. So, but I would say that the way that our program is set up is that you focus more on your research your second year. Your first year, you do have more didactic classes. When you first start, there's like a month of like a boot camp of taking classes with all of the residents at UCLA, just to get everyone at the same baseline understanding. So as a second year, that's when you start to work more on your research. So what I'm doing, I am doing a retrospective study. So I'm looking back at all of the patients that have had a panoramic radiograph taken of all of their teeth. And then I'm trying to look for developmental dental anomalies and
Mm,
compare it with different races. So I'm looking at race and I'm looking at medical history just to see just the prevalence. So maybe we can use that information to better just when we do our clinical exams and to know what to expect or what is more common in certain ethnicities or certain individuals with certain medical history conditions.
that's cool. That sounds interesting. Hopefully you
Yeah.
get published too.
That is the plan. That's the plan. So
Yes,
right
yes.
now I have all my data, and now I'm just analyzing the data and putting everything together.
Cool.
Um,
That's
yeah,
great. That's great. So so it sounds like you're really enjoying your residency time.
yeah.
What are some of the things that you've liked the most about your residency training?
Hmm. So honestly, I would say that it's a tie. So it's a tie between the recall exams and doing the IVGA. So with the recall exams, that's when I really get to talk to the patients. I really get to know them, get in their business as much as they will let me, and just find out about like what is making like kids tick.
Yep.
What is it that they're interested in these days, or what's going on in their life? Because I think that I look at this time for me to just make that connection, maybe inspire them, or maybe just listen to them. Because a lot of kids are really going through it right now with this distance learning. Like that, like 90% of my patients, they are not happy. They're just sad. Some of them are depressed.
Can't see their
So
friends, can't talk
yeah,
to them,
they are going through it. So, I know that this is a time to get out the house, just to talk to someone, and
Yeah.
also to have an adult that is not, just trying to tell them what to do or not actually listening to them. So, just making those connections and just getting to know them because you can learn a lot from kids. You really can.
Oh
So,
yeah, that's well, they made a whole TV show. Remember kids say the darnest things?
yes, they do. Ooh, they do. They keep you young. They keep you on your toes.
Yep.
So I really enjoy those conversations at my recall exams. I would also say the IV general anesthesia side because it's so clinical. I get to do so much work and use my hands. And then also, even when I was a first year, I really enjoyed this, just the intensity of just kind of like honing in on something, being so focused because you are pretty much breathing for this kid, keeping them, steady and stable while they're asleep and getting their dental work. So I really
Yeah.
enjoyed learning that aspect of things.
And that's an important aspect because like you
Mhm.
said, when they're under sedation like that,
Yeah,
kids don't have the same type of body responses as adults.
yeah,
They're still very immature, so to speak, right?
yeah,
So it's very
yeah.
important.
Very
That,
sensitive. They desaturate so quickly.
yep.
So you really have to be focused, paying attention on top of things. And I think that's just a great skill just to have, even though, I'm not going to be putting, I'm not a, anesthesiologist, so I'm not going to be physically putting kids to sleep when I'm out, but I'm going to know what to look for. I'm
Hmm.
going to know just different things to prevent certain emergencies from even happening. I feel like that's such a great tool to have.
That's right, and definitely be sure that that's going to be on your board certification exam. That's that whole
Yeah,
section.
yes, and that's what I'm preparing for now. So that time is coming up. May
Yeah.
30th is our date for the exam.
Gotcha, gotcha. So you told us a little bit about what you like. What are some of the challenges that you faced so far as a pedo resident, and maybe some of the ways that you've been able to kind of navigate those challenges.
Okay, so well, initially when I first started residency, it was just that transition of, when you're a fourth year in dental school, you got it figured out, you're kind of coasting at the end, you got your requirements, you know the flow, you know how to handle the situations that have been thrown at you for the past 4 years in that bubble. But it's like now you've graduated, you have that doctorate, and that doctorate comes with a lot of responsibility. So it's like now things are on you. They're looking at you. Hey, doc, what are you going to do? Or what do you think? And so you have to really rely on all of the information that you have learned throughout that 4 years. So that transition into residency and really being the doctor and everything that comes with it, I was like, whoa, okay, like, but I'm ready. I was prepared for this. And then also, you're not just seeing 2 patients a day. So seeing multiple patients, going to have an assistant that's looking at you to, instruct them on what to do, that transition. It took me a little minute to get used to that. But then it's like once kind of like riding a bike, you get used to it, you get in the flow, and things just kind of just start to, build up on itself. But I would also say, especially with pedo, everyone's like, oh, you have to be good with kids. You have to, be a good communicator. You have to be a great, phenomenal communicator, because it's not just the kids that you have to communicate with, it's the parents. And I think that a lot of people are, oh, I want to go into pedo, I like the kids. And they're so focused on the kids that they don't realize that the parent plays such a big role in their oral health. The parent is the one bringing them to the appointment. The parent is the one, buying the food that is contributing to some of their habits and things like that. So it's like you
That's
have
right.
to have, that conversation, with the kid, but you also have to have that conversation with the parent as well. And that can be difficult sometimes to navigate those conversations with parents who are very, just set in their ways or in beliefs about certain things. I think one of the biggest things that I'm sure almost every pediatric dentist or resident has come across are those parents who are like anti-fluoride. So those are difficult conversations to have. So it's like you really have to be able to flip that switch of, having like your fun voice and your kid-friendly voice with the child, but then explaining things and breaking things down to an adult as well.
And having and utilizing your authority voice, right?
Yes, yes,
Expert,
definitely.
authority voice as well,
Yes,
based
yes.
on EBD and other things. So that's
Mhm.
important as well. So this is the part of the interview that people have been waiting for, which are the tips, advice, knowing what you know now, what you've been experiencing as a second year pediatric resident, dental resident. What are some tips and advice that you would give those that are considering pedo and getting ready to apply coming up the next cycle?
So for those that are getting ready to apply, I would say prepare early. The application part is easy. It's pretty much like your CV, pasting that into the application, getting your letters of rec. But a lot of things can be done before the application cycle opens, and I feel like that was something that helped me when I applied as well, just to meet all of those different deadlines. So this is a perfect time right now. What is it, February, to be working on your CV,
Mhm.
working on your personal statement.
Letters of
Go,
recommendation,
yes,
contacting those people.
go to those people, ask them, to write you a favorable letter of recommendation and handing them your CV and your personal statement. So, showing that you are prepared and being prepared is going to take you a long way and decrease some of that stress, because the same time application cycles open up, that's when you're starting your 4th year, you're trying to get requirements, everything is just coming from you. So from each and every way. So that
Right.
way, you don't just overwhelm yourself. I've seen a lot of people actually be interested into going into a residency program, but just get overwhelmed with all of the deadlines and things like that. And then they have to maybe sit out a year or just like go to work or, do something else and then go and apply, when you can prepare early. Like now is the time to prepare. So for that, that's my advice for those preparing to go to residency and starting the application cycle. But once you have been accepted, I think that it took me a minute to really hold on to the fact that I'm in residency for a reason. And if I knew everything, there would be no reason for me to go to a residency. So just being humble and being open to learning and to give yourself grace and not be so hard on yourself. You're going to make mistakes because you don't know everything. That's why you're in residency. But just to understand that, okay, now you have that knowledge that you didn't have before, and just be willing to learn from your mistakes and being teachable. I think that would take you a long way in residency.
Awesome, awesome. Um, Future plans, tips. I know you're not from California, so that means one or two things. Either you may stay or you may not stay. What are some immediate future plans, and are you maybe even considering academia at all as well?
So I think academia down the line, definitely, because like I said, with these teaching rotations, I really do enjoy teaching others. And I feel like for me, it helps reinforce what I know and stay on top of things. But I do want to go ahead and practice and learn and do things, because a lot of things in residency that you do will be based off of the way that you are taught. So different programs, everything is evidence-based. So we're not just doing whatever we want, but different strokes for different folks. So people may do certain techniques differently. So I want to go ahead and just try different things, figure out what works best for the population that I plan to treat. I do plan to treat Medicaid population. So just seeing things in my own hands and just trying different things and learning and perfecting my craft. So that's my immediate plan. And then down the line, we shall see. We shall see. I'm open. That's the thing that I have realized in life. You just got to be open for whatever God has for you. So
That's right.
I'm open, whatever He brings to me. If it's academia, if it's something else, I'm open. So
Good, good. For those of you listening and watching, now it's time we want to hear from you. Question of the day: what did you hear from Dr. Taylor that you liked, that was it's gonna help you and that you're gonna utilize in your journey in becoming a pediatric dentist? Put those comments down below. We want to hear from you as well. Dr. Taylor, again, also, what's the best way to get in contact with you? People want to reach out to you, maybe ask some additional questions about the process. What's the best way to contact you?
yeah, so I do have a social media platform on Instagram. You can send me messages at that pediatric dentist, or you can email me at Dr. Taylor Addison. It's DrTaylorAddison @gmail.com.
There
So
you
either
go.
one.
Yeah,
Yeah.
there you go. Those will be down. Those check down in the description below, guys. You'll get a chance to see those contacts for her. Well, Dr. Taylor Addison, thank you so much, so much. Very proud of you.
Oh,
Glad
thank
to
you.
glad to see that you are having success as a resident, but as a dentist, but also as a Black female doing her thing. So
Yeah.
we love that, and we continue to support you. Looking forward to staying in contact with you as well as you continue your journey into pediatric dentistry and become an expert and also become a board certified
Yes,
pediatric dentist, right?
that is the
Because I
plan.
know because I know you're studying for the boards right
Yeah,
now.
that's
So
what I'm doing right now, studying.
that's right. Knock it out. So, guys, check out these next set of videos right here. And hopefully these are helpful as well. And that's our time for today. Love, peace, and smiles. Thank you.